Rising costs and capacity constraints means there's an urgent need to scale beyond traditional models of care. We know that digital models of care can help achieve this, but in parallel, we also need to harness the power of data lakes that sit behind these digital models of care to truly enable scale and have a meaningful impact. Solutions like Cardihab can help healthcare organisations deliver this end goal and truly help them to deliver high-quality models of care at scale. In this episode today, I speak to Helen Souris, the CEO of Cardihab, who are delivering innovative solutions that leverage the capabilities of technology and data to improve outcomes for patients and healthcare professionals. In this episode today, we talk about how artificial intelligence can help with cardiac rehabilitation. We talk about the different funding mechanisms like grants that health tech innovators can access, and a lot more too. Collaboration starts with a conversation, Team Health Tech. Let's make it happen. This is Talking Health Tech with me, Peter Birch, featuring content and community about technology in healthcare. Hey, Helen, how are you?
I'm really good, Pete. How are you?
It's great to have you on the show again. And actually, now I think about it, this is kind of like the Helen Souris setup. Every time I have a call with you, you've got this lovely backdrop with the books, and it's not a virtual background, it's the right background. And
it's real. I can take any one of those books off and read them, or there's scotch up on the top shelf as well if I need to. So
it's got the order of priorities. I love it. I love it.
Yeah, it's all here.
Those watching on the website or on YouTube will be able to see that. If you're listening along, you'll have to use your imagination. But it has been a while since we've had you on the show, Helen. For those that don't know you and Cardihab, just reintroduce yourself a little bit more.
Fantastic. I'm Helen Souris. I'm the CEO for Cardihab. And Cardihab is a company that's trying to help improve access to programs that help patients that have had a heart attack or have had a heart procedure. So we're really trying to offer our digital therapeutic to people who need help recovering from those sorts of events. We are a company that spun out of Cyro many moons ago. And the digital solution that we have has been adopted across Australia in a number of different types of health settings. So private health insurers, public hospitals, private hospitals and community care. And we're making great inroads to helping, achieve our goal of improving access to cardiac rehab.
Amazing. And you've had it's always something on and always happening. And as you've suggested, it's continued to grow. But more recently too, there's been some great wins. What's been happening recently with Cardihab?
I think one of the things we're most excited about is now that our business has matured, we've got a really rich data lake that we've been building and generating through the use of our program. And now we're actually at a point organisationally where we can start to bring value and meaning of that data back to our customers. So this is a really exciting stage where Cardihab now has been able to look at the data that we've got and start to create an analytics environment where we can provide insight and meaning back to clinicians and business administrators around the use of our platform and how it can help their services grow. So we are leaning into the data. Everyone's talking about getting into data and everyone's excited about what they can do with data. We're one of them. But I think one of the unique positions that we're in is that we generate our own lake of health data through the use of our programs. And it's how do we harness the data that we generate so that our customers can do more with what they do and treat more patients with their services.
Hey, on that point too, because I know the term data lake is actually in the Talking Health Tech glossary on the website. There's a cheap plug for our own glossary of terms there, which is helpful too, because we talk about these things and I hear, when we talk about the data, it's important to think about the data lake. Is data lake just a fancy way to say data, or what do you mean when you say data lake?
Yeah, it's just a fancy way. In the old days, we called it database. But now it's more fluid, right? Because there's more stuff coming in and out of it. So for us, the data lake is just the composition of all the information that we collect and harness from our patients. That's heart rate data, walking data, medication adherence, stress monitoring, everything that we collect as information about our patients and their health journey is captured in our lake. The same goes with the clinicians' overview of those patients and how they've managed them through their care program. So we capture both care program process data and we capture patient-reported outcomes data. and clinical outcomes data. And that's why we came up with this funky little term called CROPS. And CROPS stands for Cardiac Rehab Outcomes and Process Synopsis.
Yeah, right.
And all that comes from our lake.
Got it. It is important to have a fancy acronym too. No, but that makes sense. And you think, and I think about the different reasons why you would have that too, in terms of those points that you raised about making it making more information and data accessible to a clinician to make more, whether it's informed decisions or remotely monitor. So that's good from a patient side of things too. But there's much more to it in terms of the benefits of really leaning into the data side of this kind of stuff to do more than just have that very real outcome of better patient outcomes. What other benefits come from it all?
Well, I think we were at the Australian Healthcare Week conference a couple of weeks ago. And what was a really hot topic there was there's a lot of data that goes into a health system record, like an EMR, and that's where it stays. It doesn't actually come back to a clinician to help them make a decision about the patient they're seeing in front of them. And that one directional data is basically a lost insight. So until we start to get the data that we enter into these electronic systems back in front of the doctor or nurse or allied health care person, we can't do anything with it in the moment that might actually make a difference for the patient's outcomes. So that's a really important enablement thing that we can bring through Cardihab, through our CROPS product. So when you actually have someone in front of you and you see their blood pressure readings and you see those spikes and those troughs, and you can see that when you're talking to that patient, you can do something about it in the moment of care. Well, when you see that their medication adherence is all over the place, or when they've stopped walking, they used to do 5,000 steps a day, now they're down to 1,000. You can have those conversations with the patient, actually intervene and see what's going on. And that's what the power of having data visible in clinical decision-making can mean for a patient outcome. From a healthcare administrator outcome, from a business decision support kind of outcome, you can look at, well, we've got 10 nurses available to us and we can manage, in a traditional sense, 100 patients. How do we optimize that so we're getting more patients into care and reducing our wait lists? Because we can't just keep adding healthcare professionals. They're not available. It's a scarce resource and already they're overstretched. So you can't just keep adding people to the equation that are healthcare service providers. You actually have to look at how do you improve your systems, how do you improve efficiencies so that you can treat more patients without blowing out your resources. And so that's another area where process data, the process part of CROPS, helps clinical teams and helps health services plan their workforce and their resourcing appropriately. So there's really an important balance between clinical decision support, but also clinical workflow operations and I guess process planning, which you can get from the data that we're creating and generating through CROPS.
And is that where all the hype and excitement comes in around using artificial intelligence to do that process improvement? Is that predominantly what we're talking about here?
Yeah, that's part of it. So one of the things we see really commonly celebrated in that whole AI ML space is processing terabytes of data quickly so that you can make a clinical decision quickly. And I think that's where we start to see the excitement that we're building with our product too, is that when we have 5 key measures, for instance, that actually really drive a clinical outcome, someone's sleep, someone's medication adherence, someone's heart rate and blood pressure, and someone's stress and anxiety. If we're looking at 4 individual sets of data over time, can a human adequately or efficiently analyze that data to determine how well the patient's going or not? And can we do that better with AI? And that's one of the questions we're answering. The other thing is, of the 100 patients you might have in your health service, which one needs the most urgent attention? Because some of them might all be fine and doing their programs and doing great things and having great recovery journeys, and some of them need a lot of help. So how can we actually help bring to the surface those patients who need more help, more urgent care, through some of the algorithms that we're building into flagging and spotting those ones who are not doing well? And they're both really important elements of, I guess, optimization for our platform that will enable more people to be cared for, and not by simply adding heaps of extra headcount in staffing.
Yeah. And does this open up thinking about then, what that means then and building some of those fundamentals and that capability, I guess it's really then about deciding what's most strategically relevant about what happens next. For example, from a clinician's point of view, there's one thing to be able to look at your own, or even a hospital settings point of view, like your own patient cohort, but then potentially there's always opportunities to look at benchmarking or looking at like other opportunities too, or it might be looking at what's relevant not just within Australia but in a global context. That really getting those foundations right in terms of that capability must be just the tip of the iceberg for you.
Oh, totally is. And, when we started this data journey, we really did make sure that we were conscious that we're starting at a certain stage and our vision takes us 20 stages ahead. So we do have a big vision of where this could go. Anyone who's looking at data at the moment could be thinking about both immediate short-term benefits you could bring from better data analysis and insights. But when you take it to population health, when you take it to health channel comparisons, what outcomes should we be resourcing our health systems for? Do we improve and increase the resourcing and capabilities in a digital way in general practice, allied healthcare community services? Do we need to create more virtual hospitals? That sort of higher level macro planning should be informed by data, and it should be informed by data that delivers an understanding of what clinical outcomes can be achieved through those technologies. Not just digitizing things for the sake of digitization. It's actually a meaningful informant, I guess, of what health policy should be, and to that point, what should be reimbursed.
And building all of these capabilities and continuing to expand, it all requires investment, time and effort and
Yeah.
funds.
Yeah.
That's always finding that fine balance, particularly in those, I was going to say early stages, not early for Cardihab. I guess in the broad scheme of things, relatively early still from your side. Like I guess there's different mechanisms for organizations to be able to access funding, to be able to do these things.
Yeah, look, I think capital to deliver the vision is so hard to get in Australia. It really is. And initially, when we thought what we needed to do in order to keep us going with this data vision, we did try to sort of get capital from usual channels here in Australia, and it just wasn't there. It wasn't enough, and it wasn't. I guess investors aren't necessarily clear on what the data journey could be for an organisation like us. So we really had to look quite critically at where could we get funding to actually help us keep this vision going and actually deliver this product that our customers have said they wanted. So that's why we applied for the Accelerating Commercialisation Grant. It's a really amazing opportunity to put forward an idea that needs support and funding. It has to be novel. It has to be important. It has to be something customers want. And that's why it's called Accelerating Commercialisation. But we certainly could not have progressed on our data journey without that funding. It's a grant that we felt was quite an amazingly complex procedure to get.
But I was going to ask you about the
Yeah, it's long, it's complex, it's incredibly thorough. It's not just given out lightly, right? So there is a lot of governance around it, which is really important.
Yeah.
But the process is as important for us organisationally as it was to get the money, because it does help you really sharpen and refine what your product will deliver and how you articulate that so that people can understand that idea and actually see the vision forward with you. So we are incredibly thankful. We couldn't have done it without it. And this is, again, just the beginning of our journey. But as the name sort of implies, accelerating commercialisation means you're beyond just a concept of an idea of maybe. We've got some real backing behind this concept. We've got some real demand in the market. And we've certainly got a lot of evidence that this is the future. It's a core requirement of anyone doing a digital therapeutic or anyone that's in this space needs to have the ability to action the data.
Yeah.
And that's why it's so important for us to have had this initial funding, and we're going to make the most of it as we go through this first stage.
Yeah. Well, I guess on that point of making the most of it, a lot of this game of, creating solutions that have a meaningful impact in healthcare, particularly if they're novel or innovative, it's difficult getting that initial kind of buy-in, en masse. So it requires those first believers, whether it's from a funding side, but importantly in healthcare from the adoption side, and then those give confidence to others to do that too. So I would imagine that all these things, like the accelerating commercialization grant, the delivering on parts of this vision, hopefully that gives confidence to see the more health systems to see the power and the potential around the space of digital therapeutics, but in particular from a Cardihab side to adopt and grow with you too.
Yeah, and I think that's where we have a real responsibility now too, is that we've assembled some incredible partnerships around us to help us deliver this program of work. We have really, I guess, a novel data lake that no one else has. And we have a responsibility to use that with the right focus and the right purpose, and not for our own gain, but for the benefit of our customers and our patients. So it's really important that we are responsibly applying our approach to this project to deliver back to the people who would benefit from it.
Mm.
But we do have also the same challenge as everyone else is in this data space, is they want to do more. Let's just do the small stuff. Let's do it well, and let's progress in a considered and governed way so that we're not racing off to do all this cool AI and ML and stuff that everyone wants to do immediately without really setting up the right frameworks and structures and governance in place. It's really critical that we appreciate the sentiment around data protection and governance and the standards and all of the frameworks that need to be in place to make sure data is used appropriately. And that's why we really also want to make sure that whatever we're producing within this product sits very firmly within that expectation and within our consent and within our customers' desires for how they would use the data from the way that they've generated their product, their program, with our product. So there's a lot of things to think through. There's a big responsibility to do it in a considered way, and an ethical way and a compliant way.
Yeah. And to that point too, around, the responsible and considered ethical use of data and what you're trying to achieve, you can hear of stories of organizations that lost their way with all good intentions, but under extreme pressure to deliver on outcomes and expectations that were tied to funding. And, we've seen some great outcomes from VC-backed health tech. I'm not against that as a thing, but at least from your side as a founder of an organization that can have the right considered approach towards the use of data in healthcare and have a meaningful impact and have get to that next stage where you can then raise the next round of funds to do even more. I guess that's the thing, but it's about getting through those stages and doing that and building that trust along the way. It's healthcare moves at the speed of trust was a quote that I heard someone say, and
that's a good one.
Have to. Yeah.
So I think that comes back to the reinforcement of what our purpose is as Cardihab. So our purpose statement is to provide patients with the care that they need in ways that work for them. And if we are truly centric to that purpose, then as long as what we're doing with the data enables that to happen, then we are solid with our, I guess, alignment on ethics, values, and governance around the data. Because the patient in front of the clinician is the one who will benefit from all of the work that we do in clinical care plan design, in the use of data, and the use of analytics. So as long as we and our customers are aligned on that objective, then we have a really great chance of making that difference and delivering on our purpose in the right way. And I use the word right a bit provocatively, but right as in compliant, aligned with legislation, governance principles, and not for a rapid commercial gain at the expense of all else.
Sure. Absolutely.
That might be not something that our investors want to hear, but I think ethical investors, which we have in our pool, are really excited by that goal and that alignment with our values of doing the right thing.
Yeah, absolutely wise words. Thinking then about talked a bit about the vision and the future for Cardihab, which is really exciting. But to one of the benefits of doing this podcast, there's always those that want to reach out, help along the journey or learn more too. And no doubt there's been plenty of health tech vendors thinking about alternative methods of funding or the ethical use of data. They've got some benefit from this conversation. But in terms of Cardihab right now, where you're sitting, for those thinking of reaching out, whether it's to you or people in the team, who would you most like to hear from right now, and what's immediately on your radar?
I think from our perspective, our focus this year is to really get as many patients treated with our product as we can to actually deliver on our goal around improving access to care, but also hospitals or health services that value that data piece to reach out and have a chat on how we can help them. What we're finding is that with any early adopters of digital therapeutics, there needs to be an organizational alignment and a desire to move forward for you to be able to have an impact. And if you don't have that organizational alignment, or if you haven't yet as an organization worked out what value you place on health data and on digital therapeutics as a transformative piece to your health system, then it's very hard to change that
Yeah.
as you try to introduce a new solution. So we'd welcome anyone who's already made a bit of that transitional journey, who understands what a digital therapeutic is and what it can mean for their workflow, and who have an appreciation of the data to reach out, because we are in our current customer pool, we're actually working with some of our customers now on this data product, and they're actually starting to see amazing efficiencies and growth opportunities just by tapping into this very early stages of the crops data that we're collating. So we'd love to hear from people who have that maturity and appreciation in their organizations for the value of digital therapeutics. We also welcome anyone who is passionate about seeing a change in the adoption of digital health solutions in Australia, because that's part of our alternate, I guess, or parallel ambition, is to really see that digital therapeutics are not seen as an app.
Yes.
They're not just something that you add to your clinical workflow. It's actually something that needs to be designed in. And we are very passionate about that, because we've seen incredible examples of when it's done well, of what a difference you can make. And if everyone that's listening to this has any contributions they want to make, we're happy to contribute as well. It's really important that 5 years from now, we look back at this moment and think, how did we ever live without a digital therapeutic cornerstone into the workflow, not seen as an extra app that sits on the side?
So important. Thank you, Helen. Look, it's great to be able to connect and see where things are at now. And I love your perspective on all of those things, particularly around the adoption of digital therapeutics and where it sits within that workflow. We'll put the details for Cardihab and yourself in the show notes of this episode for people to check out. And obviously you've got the listing on the Talking Health Tech website for people to learn more about the organization too. Always a pleasure. I'm sure we'll chat at the next thing, whether it's the Medical Software Industry Association or whether it's the DHT Plus community and somewhere around the traps or at events. But Helen, always great to chat. Thanks so much.
Thanks so much, Pete.
For more content and community about technology and healthcare, visit talkinghealthtech.com.